Hello, everyone, and welcome to this week's webinar. My name is Sally Lajab from the programs team here at Shara, and I'm happy to have you all join us in this webinar today. These webinars are a series of online talks, panels, workshops that we run here at Shara to be able to provide support to our community and our entrepreneurs and getting them in touch with experts from across different industries as part of the hashtag SmallBizUAE initiative for COVID response. Today, I'm joined by two great founders in their industry, Sara Ramadan, who's the CEO and founder of Pharma Vigate, and Haris Agadi, who's the CEO and founder of Medi. And I'm very excited to have them here with us today to share their experience and insights on the healthcare technology industry. I'd like to first welcome our speakers. Welcome, guys, and I'm very excited to have you guys here today. And I'd love for you guys to start with a small introduction just to let people know a little bit more about Medi and Pharma Vigate. Haris, do you want to go ahead and kick off?
Yeah, sure. Hi, everyone. My name is Haris. I'm co-founder and CEO of Medi. We're essentially a doctor booking product. We help patients find best doctors and book appointments with them. We operate in Qatar and UAE. So we're scaling up our operations. We're one of the largest doctor booking product in Qatar and UAE at the moment. Happy to share our learnings. We recently raised our Series A around late last year, and during COVID, we were able to launch some new product verticals. So happy to share the learnings.
Great, thank you so much. Sara?
Yes, sure. Hi, everyone. Thanks, Tali, for the great webinar today, and it's our pleasure to be there. My name is Sara Ramadan. I'm a pharmacist by, we can say, profession, and my passion is technology. And Pharma Vigate Academy is a VR academy, enable pharmacy professionals and students to be educated and trained in a different way, where we provide them with a hands-on experience regardless of any conditions. So we give them the best simulation with the best experience with the VR. And we just started in the market this year, and we are moving forward, alhamdulillah, everything's fine. And it will be our pleasure to share what we gained through the journey.
That's great. Thank you guys so much for the introduction. And I think similarly, we'd also love to know a little bit more about the audience that's joining us today. So I'm going to go ahead and share a poll that is going to be launched for the attendees, just for us to get a little bit more insight on who's joining us today and what are they kind of looking for. So I'm going to give you guys a couple of minutes to fill in the poll and look at the results. But meanwhile, Haris and Sara, I think one of the main things that we wanted to kind of look into and get your insights on is an outlook on the health tech industry. And the best place to start is to look into how the landscape was like a few years ago. One of the main things that we, I think maybe can start off with is from a fundraising perspective. And how was that looking like when you first started? Haris, I'd love to know your experience. I know that you guys have been in the market for a while now, and during your fundraising activities, while you're kind of looking to kind of scale up the business and go into the first phase, initially when you had started, what was that fundraising landscape looking like? What was the appetite from the investors' point of view in that respect?
Right. Yeah, sure. I think fundraising is a very big challenge, regardless of which sector you're in, and especially in the region where you don't have that many VCs. When we were trying to fundraise, I think 2 years ago or 3 years ago, we were raising our first ticket round. It was quite difficult, honestly, because A, you don't have that many VCs, and B, you don't have investors who understands healthcare that much. So when you think of healthcare, they think of regulations, they think of hospitals. They're like, oh, it's very regulated, we don't want to touch that. So the awareness was not there. But in the last 2-3 years, a lot of momentum has built up, a lot of education has happened. So investors kind of understand what health tech is about. And then the good thing that has happened is, like, you have people from industry trying to join these venture capital funds, so they have more exposure to these domain expertise. So in the last 2-3 years, it has improved drastically. So investors are very well aware of how these business models work in the region and how they have found other similar companies in other part of the world, so they can kind of compare and contrast and have a better mental model of how to, judge these startups or how to understand there is a business model and everything. So I think in the last 2-3 years, it has changed pretty drastically. Of course, the biggest challenge with healthcare fundraising is that regulatory plays a big role. And I think regulations have also eased up quite a bit in the last year or two to making it easier for health tech companies to incorporate, to start working with providers, payers, pharmaceuticals, whatever that is, right? But still, we're still a long way to go before, you know, it really becomes like a hub for like health tech that we really want, like something like Singapore or Boston to be. But it's gonna, but we're on the right direction. A lot of amazing things are happening. So yeah, fundraising was a challenge, but I think it has improved quite a bit. I think if the people are trying to fundraise for their at least health tech startup, make sure that you have a very solid go-to-market strategy and you can show initial traction, because healthcare, the problem that you usually have is that it's a very B2B sales driven process and you have a lot of gatekeepers. So investors want to see if have you really crossed that, you have initial pilot with some big enterprise customers who can really validate your business model and your value proposition. So if you have that, then it becomes relatively easy for you to have a much more stronger conversations with VCs and actually for them to take you more seriously.
Definitely, definitely. Thank you so much, Haris. And I think it's also curious to, I'm also curious to kind of know what Sada thinks of this. Sada, your Pharma V-Gate is it goes into education as well, not just health tech. And I'm curious to kind of know what was that landscape looking like for you initially when you first started with Pharma V-Gate.
Yeah, for sure. And actually, we have a different experience here because we have two big challenges. First, in education, and everyone was very skeptical why I can use technology like VR or AR in education, especially in healthcare. It's a new technology, it will be costly, it will take time to be developed here in the area, and it's not that much booming still. So it was a little bit point of conflict, we can say, especially with academics. But after the COVID, everyone is running now to see how we can transform. Now it's some kind of the normal that we need to have different virtual training. So I guess in education, healthcare, it's moving very forward and people are more aware that investing in healthcare, especially either education or other aspect, in the core in every country. We saw how countries like collapsed because of their healthcare system. So now everyone feels that healthcare can be the first line and we need to have a care of it. So that was one challenge. I guess it's moving forward with the COVID. Thanks to COVID, we are in the, I guess, right track in this. And second one regarding the fundraising, it's a female founder. Still, we are in the area where female founders, we need to prove a lot to make sure that we are attractive enough for the investment portfolio, especially I'm a solo founder. So it was like a double challenge here. And everything is changing time by time. More females are arising, especially in UAE. We have many female founders here. And people are still a little bit waiting and see what will be the scenario. But whenever you find the startups are successful enough and they are taking the care and they can, as you mentioned, cover the gap or bridge the gap, that will be in the big corporates. So they got more confident, more trust that we can invest in this, even starting with the small amounts, we've been starting with the first steps, but the scene is changing right now in a very dynamic way. Lots of work needs to be done for sure, but still we feel that we are on the right track, especially now after the COVID. So I guess things are going better.
Great. I'm happy to hear the positive outlook that you guys have. And I'm also, I find it interesting that both startups have slightly some similarities, but also some differences in their experiences. And Haris, you said something interesting about the past 2 or 3 years. I think just to kind of give the audience also a little bit of idea, in 2019, globally, there has been about $7.4 billion that goes towards health tech in investments across the world. And you can see that surge kind of moving up across the years. And I think a lot of that partly has to do with new trends that are coming into the industry, right? New technologies and new innovations that are looking into incorporating this technology to provide more impact in that industry. And I'm curious to kind of know, Haris, from your point of view, what do you think are the most interesting trends that have been introduced to this industry based on your experience?
Yeah, sure. I think I'll try to talk about the trends both in what we see in the West and what we see in this part of the world as well. I mean, for sure, healthcare investment is increasing quite drastically in the last few years, and majority of that funding is actually going on EMR adoptions, right? So big companies like Cerner and Epic were actually putting these massive electronic medical record software in these big hospitals group, because a lot of these hospitals still have very legacy old softwares which are not cloud-based, which are on-premise, and you want to make sure that all the data is accessible across the cloud and make it secure and everything. So I think in the last few years, EMR adoption has gone quite up very drastically. I think in the US now you have about 85–90% of penetration. So 85 to 90% of hospitals actually have a cloud-based EMR that they can use. Of course, now in Middle East, we're nowhere close to that percentage, and I think it's going to take a very long time. So that adoption is still happening at a very rapid pace in the Middle East. So now you have a lot of these providers who are looking at their EMR solutions, or actually don't even have one, or even if they have ones, they're on premise, which are very in a server rack in their hospitals. They want to make sure they move that to the cloud. So that stuff is happening. The byproduct of that thing is that then you have the other issue. The biggest challenge in healthcare is interoperability. A lot of these hospitals, payers, and pharmaceuticals, they all have their own different systems, but they can't talk to each other because you don't have a very solid standard that they can all abide by. So interoperability is something big that a lot of companies are trying to work towards, and hopefully in the next few years, we might see a new breakthrough that might happen and will make it easier for everyone to adopt, so that data exchange can happen much more easily. Now, the third thing is I think, of course, the most obvious trend is that telemedicine adoption is going pretty rapidly. And what the good thing is, we're seeing telemedicine adoption here in this part of the world as well, which is a fantastic scene. But the way we look at it, telemedicine is you have different outcomes towards it. So in public sector, countries which have a big percentage of their healthcare being covered through public sector, telemedicine is a fantastic thing, because in their hospitals are usually overburdened with a lot of patients. So having telemedicine makes life easier, and it can reduce the burden that you have on the doctors. Whereas in the private sector, you don't really have the case, but in private sector, the good thing is that now you can use telemedicine for primary care and mainly chronic care. So those two verticals of healthcare is going to get redefined primarily because of telemedicine. So we're still yet to see how that's going to play out. In the specialty care, I think telemedicine is not yet to make impact, because people still need to go and get checked by a doctor to do a physical examination. But there's still some aspects of it that need to be changed by that. But I think the good thing of the COVID is that now hospitals are taking telemedicine a lot more seriously. Before that, they would be dismissive of telemedicine, but now they are actually taking it more seriously, even though they have not adopted towards it to its full capacity, but they can't think of it as it's not something serious. So now they're thinking of the strategy around how to build this thing up, right? The classic model in healthcare in the Middle East is a hub and spoke model, where you have this big hospitals, and then you have clinics all across the city and the country, and those clinics refer patients back to these hospitals. But now they're realizing is they don't need that many clinics all across the countries. They can have less clinics and maybe focus those primary care doctors over telemedicine, and then use them as a referral model to send them back to hospitals for the thing. So I think the industry will change. Of course, the big thing with healthcare is it's built in a way that it's structural resistance to change. So it's going to take a while. Healthcare will always have a lower steep curve when it comes to growth as compared to other verticals. But I think we're going to have a lot of positive impact due to COVID. And a lot of these hospitals are rethinking of their strategy of how to grow and how to make sure the patient experience is better. Because of course, telemedicine is a lot more convenient. Patients like it as well. You also need to see from the coverage side if actually does it make sense for insurance companies to cover for those things or not. So I think we as Medi, we're very optimistic that in the end, COVID is having a net positive impact on the healthcare sector. My point is a lot of technology adoption is going to happen because of that. So there's a lot of byproduct advantages that are happening mainly because of COVID.
Definitely. Thank you so much, Hades. And I think I have a follow-up question to come back to you on that. But before that, I'd love to know what Sara kind of thinks about this. We've clearly with PharmaVGate, you guys are pioneering, incorporating deep technology when it comes to education and healthcare. And I'm curious to kind of know how you see that particular trend coming up within the industry across different other startups, but also what other trends that are within that same vertical, kind of combining education and health tech in the region.
Yeah, sure, Sally. Thanks for the question. It's very important. And as Harsh said, always healthcare will be the latest one to adopt anything new. Especially if you like to unify everyone, it will be the more one who will be having more regulations and more laws that can prevent this kind of easy adoption. But the good part that in the field of VR or AR, the XR area, it's very well improving, really. And we can see how amazing ideas are coming to existence, especially in the education. And the good part that decision makers in most of the countries now, they are very aware that we need to have this. We need to have another option for the training. We cannot stop labs from working or training people. Or we cannot stop sending doctors to the hospital to be trained. So we need to find another alternative that can play a role that will be good. The challenging part here that this cannot be done without the academics, without the universities, without the schools, where we have the gap, where we have this, this connection. So most of the, we can say the innovative ideas and big startups who are developing this educational part from US or Canada, whatever you can name it, they are working side by side with universities and schools. And this makes the adoption easier, it makes the development easier, and as well, you can make sure that you are on the right track. Because at the end, you are not replacing the physical training, but you try to empower it. So it needs like a changing of the mindset of the academics and professors, how we can change the way they are doing. Some of them is still a little bit skeptical if they can deal with the technology or no. But as we mentioned, COVID moved this and accelerated this mindset like maybe 10 times now. So it's much better in the adoption, but still, in the Middle East especially, we need to have more roundtable discussion between business, developers, VR experts and XR experts, and the academics. So we can make sure that whenever we are doing and developing, it will be on the right track. And that's one of the big ones. So XR is very highly motivating now. Most of the retail companies are using this. Most of marketing companies are using this right now. In education, still physicians and doctors are taking the big part, especially surgeon or like dentist or something that will be very harsh. In pharma, they are a little bit moving in this. It will be single like trials, but it's moving very well, I guess. But here we need to have more acceleration and more agreements between us that this will be the new norm anyway. So we need to work together to make this happen. So XR is very booming as a trend, but the most amazing one will be the AI and machine learning. Because after COVID, everyone is starting to find R&D. We found that we're missing this kind of R&D. We need to find another labs, another solutions that will be more agile. We need to find vaccines, not in 10 years, we need to find it in 10 days. So machine learning now is helping a lot in this kind of discoveries, and it will be very booming in the coming days, I guess. And we have some kind of R&D inside Pharma Brigade regarding using machine learning in decision making, which will empower this kind of process. So instead of having a long process, you can shorten this way. So the trends are very nice. It's very unified between us and everywhere in the world, but our adoption needs to be more accelerated, and that's to make sure that we are on the right track. But I guess overall, we are on the right track, just a little bit maybe late, but we are.
Which actually brings me to my next question, following up on what Hades mentioned. I think a lot of that delay in adoption is something that's definitely everyone is quite aware of, everyone quite recognizes. I think there's a little bit less awareness on what is the root cause of that, right? And from the top level, obviously it's a highly regulated industry, sorry, which makes it very hard for newer technologies, newer trends to kind of fully emerge and be adopted by on a larger level or on a mass level. But from a healthcare provider perspective, from a patient perspective, from your B2C kind of interactions, digging deeper, what do you think are some of those barriers to adoption? I mean, we as consumers, we're doing much more sensitive things online, right? Whether today you can set up your business account with a bank online. You can do a lot of things that you typically you're used to doing face-to-face. You're migrating, and that adoption, yes, might have taken time, but it's definitely going much faster than what we had anticipated. What do you think are some of the barriers that are still maybe not encouraging the health tech or the healthcare industry to kind of move within that same pace?
Yeah, I'm glad you asked that question. It's a very great question. It's very nuanced to the aspect. For sure, regulatory is another challenge, and that's a sector completely from a public policy perspective that requires more awareness. Again, I think the regulatory issue is that, there's just an awareness that doesn't happen. So that needs to happen from that aspect. But from the provider side and from the patient side, I don't think there is any issue from the patient side. And as you said, I think every sector has been consumerized, right? So patients can, you can order your cab online, food online, you can even book your travel online, which is a very complicated procedure. But when booking a doctor is still a very multi-step process. I think the problem is because patients are the ones who need care, but at the same time, you also have providers and payers, right? So healthcare has three big aspects, which is patients, providers, and payers. So when you have health insurance in the middle, and then it becomes a little bit more complicated from that angle. The barriers that you have is that one thing that we always want to understand is, like, at the end, we're selling it to a doctor or a healthcare institute. They are trained in their head to mitigate risk, right? They think in the risk mindset, right? So when you go sell a new technology to them, they don't like new things. They want things that are well tested, well adopted, been played out with everyone else and everything, right? So one thing that I always tell people is, like, when you look at the adoption curve, right, the innovator's dilemma, and you have these early majority, late majority, laggards, and late laggards. In healthcare, you only have laggards. You don't have any early majorities. You don't have innovators, right? Unfortunately, you just don't have that, right? You always have the late laggards. Even the smallest clinic that you go to, they're gonna ask you like, okay, who other providers are using it? What are the tests? What are the benefits of them? Have they tested it out? They always want to be the last one to adopt this thing. And the reason is, you also want to understand, because they're trained to be doctors. For them, a risk, a mistake is death or a malpractice, right? Which is a very serious consequence. So the problem is, they think only from that perspective, and it's very difficult for them to adopt to a new technology that has not been tested well yet, or does not have the proven results yet, right? So you're always going to have those issues. Now, the second issue is, like, the structural resistance to change in the providers itself. Contrary to popular belief, healthcare is not a high margin business. Healthcare is a very low margin business, because typically, if you look at any business, either they're CapEx heavy or OpEx heavy. Healthcare is heavy on both, right? You need a lot of capital infrastructure to build the hospitals and the equipment and everything. At the same time, you need to hire very high skilled laborers, like high skilled doctors, nurses, lab technicians, and everything, right? So those overheads are very expensive. Because of that, they need to set up really stringent processes to make sure that their margins are in place, right? Now, you as a company going to go sell them a new product, it is very risky for them to adopt that and ruin your margin. So they're always very structurally resistant to change that, right? So those things are very difficult to breathe. And that's the reason why you in healthcare, it's A, the risk mitigation mindset that they have, and B, given the fact that their margins are so low, they're very risk averse to try something new that might compromise their margins, right? Because they know the margins will not improve. They're just trying to make sure the margins don't degrade, right? And if you're going to bring something that even makes like a tiny 0.5% difference, that's a huge issue for them, right? And that's the reason why you have this catch-22 issue where you're too small for them to really care about you. But if you're too big, they're going to be very scared and concerned about, is like, what if it ruins our margin? So you're stuck in this catch-22 issue that always happens. So that's why adoption in healthcare just takes time. People just have to keep hitting their head against the wall and just try to keep convincing people to change their mindset about it. That's why adoption just takes a very long time to do. That's why when you look at healthcare B2B enterprise sales cycles, you're talking about anywhere from 9 to 2 years of sales cycles before they really change their mind and adopt your technology and do a pilot product and everything, right? And I don't think that will change anytime soon. I think, yes, there are some aspects of it that might happen. Now, the other issue with this, like at least from the B2C aspect, is that anything that requires adoption from B2C needs to be pushed from the provider side, right? If the provider is not advocating the solution, it's not being evangelizing it to their patients, then you're not going to get the adoption that happens, right? Because patients listen to their doctors and the healthcare institute. If a doctor hospital says like, hey, use this app to book an appointment, use this doctor to go referral, they listen to them because it's a credibility that's speaking to them. If that is not happening, then you're just not going to see that adoption that's going to happen, right? So a lot of things kind of get stuck on the payer and provider side. If their incentives are aligned, then it makes sense. The problem that happens in healthcare is like a lot of people want to build products for patients and they only think from the patient side. They forget that incentives for patients are not aligned with the incentives of the providers and the payers. It's very hard to build a solution that aligns incentives for all three of them. Then only you're going to see the adoption that you really need.
Definitely. Thank you so much for for that insight, Haris. Sara, following up on that question, and I think with health tech as well as education, I think it's a lot of those challenges that Haris mentioned are similar or common. And I'm curious to know, in your perspective, do you think that this is a region-specific challenge? Do you see this changing when we look at the international landscape How is it different in your point of view?
Yeah, sure. But, first, thanks for Harris for addressing some of these very big challenges. And this is, I guess, it's a trap for every startup. Whenever you are in industry, you need to be very ready for the market. You need to be developed before you go to the market. You mentioned before that might go to marketing strategy, but some businesses need to be very well structured, well refined before you can go and offer what you are offering. So whenever you have this kind of trap, because you cannot do this alone as a startup. You need to have such investment, such board members, such everyone that will be included with you. And you cannot go smaller than this because everyone will never take care of you, never will consider your business what you have, regardless of what value you can add. Because as Harris said, the changing of the status quo with the mindset from what I'm using to another option, it's need trust. So who will give you this trust? You don't have previous history that can be built up based on, and you don't have that much scale that you can promise them that you can change their figure. So you are stuck in middle, you are in between. That's why, again, this is, I guess, the trap of every startup. Whenever you are in this, you need some kind of supporter. And I guess we mentioned this in Shira before, that this kind of collaboration between the corporates and the startup can be one of the ways to overcome those challenges. If you are as a corporate and I can offer you a service and you can adopt my service, that might be the first entry to the market. That might be the trust. That might be the logo I can take. For us, especially in Pharmavigate, we have different challenges regarding awareness. Because whenever you mention VR or AR, everyone will start to have Pokemon Go. How I can change the mindset of the new generation that they can use the VR gears or the games, gamification as a concept, in something that will be very heavily and very knowledgeable like pharmacy. It's like a change, you know. So we found that we need to teach them what is XR, what is the VR, how they can use the gear, how they can make the best benefit, how they can turn into self-learner so they can have it. And again, if they do this, that will be very good. But this cannot be complete or comprehensive until you have a full connection between yourself as a student and educator in the university. So again, we need the university who will be the adopter, who will be believer that you can do this. And most of the time, our educational system is very stable and steady. So we don't feel that this kind of technology can make difference. It might be good, but I don't have any guarantee that it will make a difference or impact. That's why people are in this area and hesitating to do it. So awareness will be first a challenge for everyone. And second, who will be the first innovator or the first adapter for you who can take care of your business from the perspective that we can go together. Yes, we can develop it together. I can have the patience to be with you. You do what you are doing. I'm supporting you. And at the end, we have our shared success together. So I guess those will be common everywhere. We find it. And especially healthcare, whenever you go out of even our region, it will be even harder. So we were in Europe and we found in Europe it will be very strict. So if you'd like to improve like VR experience from a reverse perspective, you might take 2-3 years to have it. So it's a very long time. Your technology is like out of date. So it's nonsense to go for there. So I guess it's here and there, it will be the same, but it will be like how much you are suffering, and that's the challenges that will be.
Definitely, definitely. And I think just listening to these challenges, I'm also thinking of what the current crisis might have meant for startups in the health tech industry, right? If you think of certain other sectors or certain models like e-commerce or so, COVID-19 has been a blessing in disguise for them, right? And from your experience, Sarah, starting with you, I know it's a little bit different, obviously, with Pharmavigate, but what were some of the things, because education was kind of forced to go on lockdown, what were some of the things that you saw kind of that change in mindset, even if it was forced by the crisis? What were those change in conversation and tone looking like? What was that experience for you, especially beginning of the crisis when everyone was trying to adjust back in March and April?
Yeah, sure. As I told you, in COVID, we were a little bit luckier than others because we are in the pharmaceutical industry, which is booming more, and we are in education where everyone also is looking for something that will be different. What we learned through this, that people changing, even if they don't feel that much they are comfortable with this change right now, but they are changing. The professors, the educators, the deans are now looking for something that will be different, because it will be like a reactive, issue now. We need to have it and we need to find it. What we found that will be more interesting for us as a pharma brigade, that we need to find who is ready more to adopt this. Because if you are selling here and you're telling me, yeah, let's do it, but you don't believe it, you don't feel that this will be an impactful for your business at your university, it will be nothing. But we started to move forward regarding who would be ready, and we found that even our region or out of our region, we have many professors who are really looking for something that will be different, looking for something that will be innovative. And most of the, we can say, the higher authorities of like higher education, they are looking or obligating people to transform their content into more agile content. So now we try to attract those people who are very ready, deans and professors from different universities around the globe. And those will be our main, we can say, early adopters, as Harry said. So those will be the ones who we are building our structure based upon. And then we try to find that fine tuning that we can make our content and we are more customizable. So whenever we do it in US, it can be brought to UAE without any like limitations. So we broaden the spectrum. We try to be more smart in this. And at the same time, we attract the people who are ready to go through the journey. So I guess this was the best way we did. And hopefully it will be workable coming days and we will see what will be happening.
Sure. And I think it's very interesting how you guys as a startup kind of adapted very quickly, and you were able to kind of quickly catch on and notice what kind of things or alterations or changes you need to make within the technology, the product, the business model. And I'm going to come back to that later, but moving on to Haris, I'm also similar question. What were some of those metrics, or what were some of those things that you saw kind of changing overnight when COVID-19 and the lockdown and a lot of those restrictions and measures were put in place?
Yeah, great question. So I think what we saw is that I think it came out of the blue. We just did not expect. I think what we saw, I think the mandatory shutdown happened in end of March, like late March. We're talking about third week of March. When that happened, we're like, okay, things are kind of slowing down. But then I think a week later, they said it's like even all the hospitals and clinics are shutting down, which was like something you would not expect to happen, right? So our entire core business just pretty much collapsed. We were decimated. Like our revenues, everything was pretty much, back down to zero. But thankfully, I think within 2 weeks, our entire team, we were able to launch a full enterprise SaaS solution for telemedicine, from idea to fully public launch for hospitals to adopt. So yeah, our solution allowed them to convert the entire physical brick and mortar practice into virtual practice. So accepting online payments, collecting medical records, sending prescriptions, everything. So we were able to launch that within 2 weeks of crisis. And it definitely helped quite a few clinics to continue providing care to patients in a remote setting. Of course, we also had a lot of challenges getting the hospitals to adapt to it for the reasons I already mentioned: structure resistant to change, integrating with their old legacy-based solutions, risk-averse mindset to work with startups from that mindset. As Sarah mentioned, is like, I think the other big issue that happens when you work with these hospitals is that you as a startup don't really have a trust and credibility yet for them to adopt your solution. Like think about it. If you're like a 20 people startup and you're going to go sell a solution to a CIO of a hospital, of 2 massive hospitals who see 70,000 patients a month, it's very unlikely for them to adopt your startup solution compared to getting it from a big enterprise vendor like Cerner, Epic, or Microsoft from that aspect, right? So it's a very challenging sales cycle. And it has very little to do with the pricing that you're offering, right? Your pricing is going to be significantly lower than what they're offering, but it's the credibility that is not there yet, right? So that challenge always happened. So yeah, back to your question. For us, of course, initially COVID really hit us pretty bad because our core business model is like we help patients book appointments with doctors at the clinic. So if clinics are shut down, there are literally no appointments that are happening. But once we moved to telemedicine, we saw some spike. Of course, a lot of people were using that mainly for primary care and chronic care and getting prescriptions and everything. But I think late in June, we started seeing the telemedicine numbers go down and our core business go back up because, hospitals and clinics are opening up again. So I think that period was a very good time for hospitals to take telemedicine seriously. Of course, after COVID right now, the telemedicine numbers are not as high as they used to be, but the way we look at it is like the telemedicine numbers post-COVID is going to be still significantly higher than pre-COVID levels. So as I said, it's a good shock for hospitals to adopt this technology. Now they're taking it seriously. Of course, you don't have that adoption yet, but in the back of their head, now they see telemedicine as an additional channel for them to attract patients through, or a way for them to keep providing care towards it, right? It's not something like a novelty that they can completely shrug it off. This is something they have to take it seriously. Now, I think 1 or 2 hospitals that we're seeing right now are literally have like a full-time person dedicated to running a telemedicine strategy. They're basically, what they're doing is like they're redefining the care units inside the hospital. They're creating a special room with high definition cameras, high definition mics for their doctors to actually provide those cares to the patient, so that that setting can replicate the virtual setting can actually replicate how the in-person visit is going to look like, right? So of course, those are like, progressive hospitals who want to do that. Other hospitals are not doing that yet. But I think, again, as I said, they're going to start taking telemedicine more seriously. We still don't have that adoption. We're not going to have that adoption anytime soon, but this was a good shock for them to see that they would not have seen any other way. So yeah, I think in the end it was a positive sum. I think it was a good shock for the healthcare industry. Of course, we did not get as tailwinds as you would see in grocery delivery or e-commerce. We don't have those tailwinds, and we're not going to have that. But I think my one advice for a lot of these startup founders who are kind of building up their business model is like, one thing that you want to understand is that as humans, we haven't had a pandemic in 20, 30 years, at least even more than that, right? So VCs were not looking at if your business model is pandemic resistant or not, but now that's a framework that they're actually looking at, right? So now, and I think Bill and Melinda Gates Foundation recently announced that they expect a much worse pandemic to happen in the next 10 years. Right? So that means now if you're building a business model, you want to think about if a pandemic happens, how will your business model withstand that resistance to that, right? Will your business completely be decimated if a pandemic happens? So that's now a new criteria for VCs to be looking at in your business model. And if you can really prove that your business model get resistance to those kind of change, or it will even get it better if that happens to you, then you're in a much better position to do that. Because now, I mean, we talk to VCs all the time and board members, and now they're constantly looking at their portfolio, and either they're planning not to invest more in those companies or just rethinking their strategy around it. Is like, if a pandemic happens, how would this impact? Is it an adverse effect? Is it a positive effect? Even if it's an adverse effect, can they recover from that? Because there are a lot of businesses, they just won't recover anytime soon because of COVID, because this impact was pretty bad. Like if you look at the retail is decimated, and I don't think it's going to recover anytime soon, right? So you want to be very cognizant of the idea that if a pandemic happens, how will your business model really withstand that thing? And can it really recover that quickly? And that is, I think, a very important criteria for VCs and angel investors to be looking at right now.
Definitely. And I think one of the most interesting things that you just mentioned is also how the investors' mindset and that outlook happening after having all of us experience something like what we did in 2020. Moving on to Sara, I think my question regarding where you guys operate, I think with education, again, a lot of them have been forced to move to online learning. And it seems that moving forward, a lot of them might adopt some kind of a hybrid of online and offline learning. And given everything that you guys have learned during this crisis in this year, how do you think that'll shape what is coming next for PharmaVGate and for the health tech and education industry combined?
Okay, that's a very deep question. Okay, to be honest, from what we see from all around the globe, we can say startup enable organizations, people are going into more and more using technology like VR and AR. And I guess I never expected it will be the same, but maybe because of COVID now, you can see that even in every single university around the globe, they started to have that. Either they would have innovation hub where they can build something that will be more blended learning, where you have online and offline to make sure, because yes, we can go for online learning. Either it will be like only like a Zoom meeting that we are doing, or it will be like a fully simulative lab. But at the same time, you need to think about how you will manage it later, how to assure the impact, what will be the KPI that you can assess your students based on. So when we all went for the online just as a reactive, process. But right now, people are trying to take this more in a we can say, a wise way. They try to understand it more. They try to get the KPI. They try to understand the access or the assessment tool. So what we find that now our industry as an XR is going more mature, we can say. It's kind of refined. So not we are going for the XR, let's go with the VR. No, now we try to have like a big business model, big full process from the back end till the simulation. So you try to make sure that if you go for the blended learning, you have physical and non-physical or physical and virtual, both will work together in a very harmonious way. So no one of them will like interrupt. No one of them will be the favorite one for the students regards the other one. So you try to make this balance between them. And as well, you find to add more tools and more technology to this to make it more compatible for you. So as I told you, one of the biggest challenge now, if you're building a VR experience for pharmacists here in UAE, how this can be compatible for people from US or Canada. This will be working the same with all the unification of the rules and regulations, or you need to change the model from scratch. So people are now considering this. We try to get the benchmarking from this, the best, we can say, industry. And this will work one by one, I guess. We need a little bit more time, more collaboration between universities, more training programs that can bring something that will be more innovative in existence, that everyone can use it from our perspective. So yeah, it's a kind of, we can say it's R&D, it's a big R&D, we can say. Our project as a PharmaVigator, it's a big R&D because we try to find a way, and even our team, they found a paper about, one paper about how using gamification in XR can support the pharma education. Can we really empower them? Can we make them really ready in sometimes like a pandemic like now? Can we still train them what they need to have it, like infectious management or like patient management in that very tough time? Or whenever anything that will happen, we'll be all in the crisis together. Nobody will be ready for this. So I guess people are changing. They are more aware now that we need people to be ready regardless of any limitations, and you keep connected with them regarding if you have in a pandemic or in the normal life.
Definitely. Thank you so much, Sarah, for that. And I think hearing both you and Haris, I think with an industry or a sector that's known to kind of have operated more or less in a similar way over the past few years, I think a lot of this innovation and a lot of that, those new trends are driven by ambitious startups that are really focused on impact and are focused on creating change, just like PharmaVigate and Medi. So thank you guys for the great work that you guys are doing. And I think it would be a good having you guys on this webinar, addressing potential or aspiring entrepreneurs that are as ambitious and are looking to create a similar change and impact in the industry. What would be, starting with you, Sarah, what would be some of the words of advice that you would kind of address to someone who's looking to tackle this highly regulated, complicated sector?
Okay. Be patient. Never expect that you will find it from day one. And I guess people will work in healthcare, they should have some kind of passion. Because again, as we mentioned, it's a very tough industry. We know how hard it is, how it will be a long process. Some of people that are in decision making are so bureaucratic, so it will take longer. And it's not like, as we mentioned, like e-commerce, it can be like between day and other, it will be like a flipping. It will need to be very well structured and organized. So if you don't have a patience, if you don't have a team, if you don't have a passion for this, it will be very tough for you to complete. You can start, but it will be very tough for you to continue. So you need to make sure that you have a vision in this, you have something that you believe in. And I guess in healthcare here, especially in the Middle East, we have a lot of change to be done. We have lots of gaps we can cover, but still startups, they are trying to do their best, but they need a lot of time and effort to be addressing this. So take everything as a milestone, as we mentioned. Since we started, our vision was not only to have an VR or XR. Our vision was that we found that really pharmacists are struggling. They don't find the right jobs. They don't find the right track. Now markets are changing. We need to find other opportunities for them. We need to find how tech can change their jobs. So I'm keep telling my team that right now we are working, maybe we cannot find the fruits now, but one day you will find this academy run by all pharmacists. They are doing the VR, they are doing the AI, and they will be the one who's managing everything. So it is still a long process. still you need to have this power. You need to be very optimistic that change is happening. Everything is changing right now. And again, I guess our startups are, regardless of the crisis, we are a little bit lucky because now you either revamp your strategy or you stop it. You cannot continue with the same mindset. You cannot continue with the previous one. So you now can assure if you are on the right track, just go, continue. If you are not, just take time to re-change or readapt your strategy, and then it will work. But just take care that you will need time and effort.
Great. I think patience is a great advice for any entrepreneur, really. Haris, what would you say for aspiring entrepreneurs that are looking to tackle the health tech industry?
Yeah, I don't think I have anything new to add other than what Sarah already mentioned. For sure, you have to be super patient about how it works. And it's going to take a very long time. It's going to be a very long journey from that aspect. I think the other advice I would think about is like get advisors from healthcare, right? So if you're actually trying to tap into the health tech sector, maybe get some domain expertise that can actually guide you on how the process works, right? So, I mean, for instance, one of our big investors, we used to run one of the biggest hospital groups in Abu Dhabi. So when we used to go sell it to the hospitals in Dubai, and we give them like, hey, those are one of our backers that just buys credibility in terms of hospitals from that aspect. So I would recommend that if you're going to go sell into healthcare, either providers, payers, or pharmaceutical, get an industry expert from that domain who can actually guide you on that. And by the way, a lot of people are more than happy to help you on that aspect, right? You can definitely find one of the big executives in these big companies who are more than happy to spend a few hours a week with you or a month and just guide you through how the process works. And that learning itself can save you so many mistakes and things that you're going to go do yourself. So that's very important to have from that aspect. The other thing, as I said, I think what people need to think about is like healthcare has too many variables, too many decision makers, too many stakeholders, right? And everything makes sense if incentives are aligned. So if you're building a solution, don't just think from one side, think who else it affects and how their incentives are aligned. A lot of people either focus too much on the patient side and they like, oh, for patients, we need to build a really nice app. It should make sense and everything. But sure, it makes patients' life a lot easier, but that doesn't necessarily mean payers and providers are happy with that or makes their life easier. So that's why you don't get that adoption. So you need to make sure that trifecta is always solved. You need to make sure incentives are always aligned for all the stakeholders. If you don't have buy-in from everyone, you will not get the adoption that you really need. So I would just spend a lot more time thinking about the incentives. Are the incentives aligned or not? I think that's my biggest thing. I think incentives are literally the key to this thing. It's just, it will take you a very long time. Get some expertise that can help you out. As I said about go-to-market strategy, I meant by that is like, make sure that when you go sell it to a hospital, you want to make sure that they understand that, there's a value for them, there's a value for patients, there's a value for insurance companies and pharmaceuticals if that happens or not. So make sure incentives are always aligned so that you get the adoption that you really need. Thank you,
Haris, and thank you, Sada, so much. To be honest, I think it's been a very fruitful and valuable discussion for everyone that's tuned in, and I'm so happy to have you guys. I'm going to go ahead and move to the Q&A. Back then, earlier when we had launched the poll to know a little bit more about the audience, a big majority of them are full-time entrepreneurs, so I'm very curious to know the kind of questions we're getting today. I'm starting off with the first one. For you, Haris, going into the market initially when you guys first started, I think there's a lot of similar startups or startups that are trying to kind of penetrate or solve the same problem as Medi. And I think with competition, what was your approach going into the market and how did that guide your go-to-market strategy? And how do you kind of advise startups that are going into a moderately to highly competitive market and trying to launch their business?
Yeah, sure. So I can speak competition from a healthcare perspective. There's so many other doctor booking products that are out there. So I always say we're not doing something super innovative. What we're doing something is super practical that actually adds value to the providers and the patients and everyone from that aspect. Honestly, it's not the competition that bothers us. As Sarah said, it's the status quo, right? It's the mindset that hospitals have to work with us. Most hospitals, our customers that we work with, they work with our competitors as well. Right. And because nothing stops them from working with, like if we are basically providing we're essentially providing value for providers by attracting them new patients, right? And they can attract new patients through several different channels, right? So we're just one of their many channels that they use in their arsenal of attracting new patients. So they work with us, they work with our competitors, they work with a gazillion other sources to attract new patients. I think in the end of the day, if we end up providing value, if we're providing them new patients, if we're providing patients in a cost-effective way, it makes sense for them. So my advice is not too much about focusing on your competition. You focus on your customers and how you're solving problems for them, right? And then you can ignore completely about competition. There's so many other doctor booking products that exist in the UAE market and in the Qatar market, but it's not something that bothers us. We honestly don't really even compete with them. We compete with the hospitals' mindset of working with us. Our biggest issue is getting hospitals to work with us and giving the attention to the product and actually getting the adoption that we need, instead of worrying about is our competitor doing better than or not. So we honestly couldn't care less about our competitors, to be very honest with you. We are more concerned about is how can we make sure that hospitals will really adopt the solution or not from that aspect, right? So that's my thing, is like, make sure you have something unique and make sure you can quickly provide value. The other issue that happens in healthcare is that things take such a long time that you might sign up a hospital, but they're not getting any value for the next 3, 4, 6 months, and they will then not get the adoption that you need. They will stop paying attention to your product and not really give the attention that you need, because the thing that you need to understand is like, it's a very bureaucratic sales process. So if you get a person in the hospital who's adopting a solution, he or she needs to convince other people in the organization to pay attention to this product, to actually utilize the product, to give the reporting that they need and analytics and everything need. If you're not providing from day one, that person is not going to fight for you. So you need an internal champion in that hospital to fight on behalf of you with all the other people in the organization, right? And the only way you find that champion is that you provide value for that person from day one. You really show that how is the value clear to them. If the value makes sense for them, again, incentives align for them, they will fight for you, because it's, in the end, it's good for you. So make sure, how are you going to provide value as quickly as possible?
Thank you, Haris, for your answer. Moving on to our next question for you, Sara. I think based on, you guys have been in the market for a few years now, and obviously with that comes a great deal of learnings and challenges that you guys have experienced and successfully overcome. And I think the question from the audience is that if someone asked you if this is the right time to do something in the health tech and education industry, would it be something that you recommend currently, or do you think that the sector still requires a little bit more time for new innovation and startups to come in?
Okay, that's really tough. Okay, so to be honest, it will refer to your vision. It's whenever you have a startup, you feel that you have a journey to go. So you might decide that I feel that it might be very interesting for me and very good for me to go as the first in the market, and I will have all the effort to pave the way. I will go for it. I will learn them. I will teach them. I'll go for a single aspect one by one. At the end, you will take the credits because you are the first one, and it will be very good, but it will be very tough as well. Otherwise, you feel, no, I don't feel the market is ready now. We don't have, as Haris said, sometimes whenever you have competition, it's very good because other people pave the way. So you don't have all the effort on your shoulders. So it will be much easier for you. But again, whenever you go, you need to go with them and you need to prove that you are the first one, or you are the best, or you can either compete or try to differentiate yourself. That will be your decision at this time. But I feel that healthcare and education now is the main focus. After the COVID, we have some kind of industries that will be on their main focus for a long time. And all the countries will be very keen to invest in. To make this will be very mature. It will be very well constructed. So healthcare will be, as we mentioned, a long journey. Education will be a longer journey. But at the end, if you have enough passion, you can bring something that will be very new, very unique, and you will enjoy the journey because you will be the one. So it again depends on you, depends on your solution, how ready you are, and how you feel that you can make difference. If you have a mission in this, go ahead and have it. It will be tough, but you go. But if you are looking for the quick gains, I don't think that will be the best. Maybe you can have like a service providing that will be much better. Certain aspect that will be much better. You know, so you go for a small part, a small service that you can provide in healthcare education that you can focus on, and then it will be. So I guess it's very variable, but at the end for me, I feel it's deserved if you're going in the first one. Who will do the change if everyone will wait?
Definitely, I agree. I agree. Thank you so much, Sarah. Another question for you, Haris, on a slightly more technical aspect, is asking, one of the audience members is asking on your views of using blockchain for storing electronic health records. How useful do you think that is? What's your what's the potential that you kind of see for incorporating this kind of technology, as well as what are some of the challenges that you would anticipate in this regard?
Yeah, that's an interesting question. Again, I'm no expert on blockchain, so I'm not going to even pretend to talk about that from that aspect. I think the way I would think about it is that hospitals at the moment are already struggling to adopt regular EMR that are built on regular MySQL databases, right? And there are challenges even from that aspect. Again, I think the thing that people want to think about is like the challenges that you have in healthcare are the same challenges other industries had in the early 90s. Right, so they solved it back in the 90s through digitizing a lot of those things. I always tell people, when you walk into a hospital, it's like you're just in the 90s, right? Everything is like paper-based. A lot of those things are not digitized from that aspect, right? So you want to build something on blockchain and have EMRs on that. I don't know. Honestly, I don't know if how much of an impact it's going to make. I'm not saying it's bad or good. It's just, I honestly don't know. I'm just telling you that in the current status quo, you still don't have massive EMR adoption in this part of the world. They're already struggling to make sure everything goes on cloud-based. Even the hospitals that have EMRs, they prefer to have it on-premise. They want to have a server rack inside their hospitals doing that. You can just think about how they think. That just gives you a mindset of like, they want to be very sure that they can actually control a lot of those things. So they're very concerned about from that aspect. I think what you might want to think about, that the person who wants to build EMR on blockchain, is that how does it, like, I think the way to think about it is like, if this thing is implemented at a hospital, does that help them make more revenue? Does that help them attract new patients? Does it help make their operational processes any better? If those questions are not, if the answer to them is not, yeah, obviously yes, then probably you will not get the adoption that you need. Right? I just think from that perspective, it's like, how is this something on blockchain is going to compete versus people having regular EMRs, having it on cloud base? How does that make any things better, right? If the incentives align, does it make sense for the patients? Does it make sense for the providers? Does it make sense for the payers? If the incentives align and the value proposition is very clear. A lot of times, a lot of startups want to build really cool, amazing products, and the value proposition is clear in their heads, but it's not clear to the customer. If you can actually make sure that it makes sense for all those three people, then maybe there's a shot for this thing to work, right? But honestly, I don't have any expert opinion on this thing. I just think like, you just want to make sure, if you're going to provide any solution in healthcare, how does it make sense and how are the incentives aligned for all the three stakeholders?
Definitely, and I think that's just to add in to what you're saying, Haris. I think the typically from my experience working with startups at Sharaa, typically whenever we ask founders about their value proposition and how that aligns with all of the stakeholders that are involved, I think that's something that founders tend to kind of take for granted, especially in the beginning. They're usually quite in a hurry to build something and put it out into the market. And there's definitely some legitimacy to that, right? Because you do want to be lean and agile as you're doing things. But I think this is one of the main kind of common pitfalls, right? Or one of the easiest ways that things can go wrong is not kind of providing enough thought and attention to that value proposition, how it aligns with different stakeholders. So thank you so much, Haris, for reiterating that for the audience. One of the final questions we have for today, Sarah, I think more on the, talking about some of the things that we spoke about earlier. I think initially when people think about health tech and healthcare industry, you think as regulation as the main bottleneck to innovation in the industry. And I think one of the main things that you and Haris have highlighted is that no, there are other stakeholders that are also kind of resisting that change for whatever reasons. And the question is, if where does a startup role play in terms of providing awareness for those stakeholders? But also, is there anyone else that can kind of do something to help ease that resistance to change and help increase that adoption. Curious to know what you think about that.
Okay. So yeah, it's a very interesting point because I feel now, yes, we as a startup, we are trying to raise awareness in this, and we try to, got the buzzwords and try to figure out what will be the gaps that we can cover for sure. But I guess now as well, all the countries are looking for something that will be uniqueness regarding this, like performance. So you have many parameters, you have many records that will give you like a ranking, that will give you benchmarking, how good or bad you are in this. So every industry now is looking for them from the international perspective, and you start to analyze. So if I'm a university, I'm trying to figure out if I'm number 20, who's number 10 or who's number 1 and why they are number 1. So this kind of benchmarking, I guess, is one of the main core aspects we try to address. And people who went through this kind of innovation in education, they went through a very good and solid results. So this is one of the main topics that we try to figure out, and all the time in PharmaVigate we try to bring the best practices in education and in healthcare. So we try to bring that in Canada, people did this, or in Zimbabwe, people developed this. So many countries are competing together now to bring the best of innovation and make the best use of this crisis, because I guess COVID was not only a crisis for everyone, it was a lesson to be learned. It was like some kind of, it gave us a real KPI, how you are performing. So are you doing well, or you thought that you are doing well? So it's kind of a real reflection on how we can say the constructive way you build your structure from all the aspects. So now this kind of benchmarking, this kind of ranking is giving them alert that yes, we can move forward in this. We still need to have, as Harsh said, a full stakeholder engagement. Everyone should be there. So how you can bring investor who will be very interested in education, while it's very long-term like investment, with the decision maker, with the academics, with the business. So everyone will work together. And since we started, we told them that we know we are in challenge because we are in the gray area. We are not academics pure, we are not business pure. We tried to bring you both on the same table. So it was a little bit challenging in the beginning, but I guess now everyone started to collaborate more, because this is the only way that we can overcome this impact of the crisis, and we can have a new norm or the new start after the COVID. So yeah, that's why looking for what people are doing around you is very essential in our business.
Definitely, definitely. Thank you so much, Sarah. And thank you, Haris, as well. It's been a pleasure having you guys with us today. And I'm very thankful for all the insights and valuable outlooks that you guys provided for us today. I'd like to kind of go ahead and also thank the audience for joining in today. We are very keen on knowing what you guys thought about today's webinar. So we're going to be posting a feedback form on the chat function. Feel free to go ahead and check that out. If you guys would like to know more about the webinars that we're hosting at Shara as part of the hashtag SmallBizUAE initiative, feel free to join us and follow us on our social media channels at Shara Sharjah on all social media platforms. Sarah and Haris, thank you guys very, very much for this great talk and discussion, and wishing you a good day and a happy weekend coming ahead.